Gilbert is the medical head of the Clinic of Emergency Medicine at University Hospital of North Norway, and he joins us live now from Oslo. Mads, have you ever witnessed anything like what's happening at Kamal Adwan Hospital?
Well, unfortunately, memory is short for human beings, and if we think back half a year, they bombed and burned and killed staff and patients at the Al-Shifa hospital. They bombed and killed staff and patients at the Baptist hospital. So what's happening in Kamal Adwan now has also happened before, but the special thing about Kamal Adwan and El Auda and the Indonesian hospital, the three important hospitals in the north of Gaza, is that they have been under a brutal siege for 3 weeks and that they are now militarily attacked and shot at. And as you may have heard, they have today shot at the third level of the hospital and destroyed the medical storage. They have also destroyed the oxygen concentration machine, and they have destroyed the desalination plant necessary for the dialysis patients. So this is a very deliberate military attack from the Israeli occupation forces on the capacity of the hospitals to treat wounded and sick people. And bear in mind, at the same time as they are taking out these hospitals, they keep bombing the civilian parts with horrible results, and the hospitals have to accommodate 10th and 10th and 10th of new trauma patients for which they do not have the capacity to treat. And today, the brave Dr. Hussam Abu Safia, the medical director of Kamal Adwan, he issued an appeal to the world to send surgeons to Kamal Adwan to operate and to save the lives of those patients already in the hospital.
Just to be clear there, Dr. Gilbert, you say, when I asked you, have you ever seen anything like this before? You say you have, but only in Gaza. Have you ever seen anything like this outside of Gaza?
No, never. I've never seen anything comparable to the Israeli sadistic brutality when it comes to attacking healthcare in Gaza. It was recently, 2.5 weeks ago, released a new report to the United Nations General Assembly, a specialist report, and they summed up that Israeli occupation forces since the 7th of October until the 1st of August had perpetrated 1,018 attacks on Palestinian healthcare in Gaza and the West Bank. And the last number from the Minister of Health in Gaza is that the Israeli forces have killed more than 1,000 doctors, nurses, and paramedics in Gaza alone. These are numbers that we have never seen, and no other governmental state army has ever done such crimes against humanity as the Israeli occupation forces are perpetrating as we are speaking. And of course, it is obscene, and I cannot comprehend how the world leaders, the US government, the Canadians, the European governments, the EU, are accepting and not stopping Israel from perpetrating these continuous attacks on healthcare.
And I know you have joined calls for more medical aid to reach the hospital. We know that some aid has managed to get through in this time because that aid was destroyed, some of it anyway, in this latest strike. How difficult is it, and how does it even work to get things through, and what's needed at this point?
Well, what is needed at this point from a medical point of view, to be honest with you, it is an immediate ceasefire. As a doctor, I have a prescription which contains 3 different things. Number 1, immediate and lasting ceasefire, stopping the bombing. Number 2, immediate lifting of the siege of Gaza. And number 3, free flow of food, water, medical supplies, and all other supplies and medical teams into Gaza under UN control, not under Israeli control. This is what can be done to amend the medical situation. We can always pour in more bandages and more drugs and more field hospitals, but we have to solve the root cause. And the root cause of all the misery we see in Gaza and in the West Bank It is the Israeli occupation of Palestine. It is their aggressive colonization and expansion and the land grab. We cannot only talk about a humanitarian crisis. This is a massive political and moral crisis for the West, because if this prevails and if Israeli impunity prevails, we are all in a very bad place, because who will be the next country they will attack? So yes, it is difficult to get supplies in, and it's only a drip of supplies that gets in. The last UN report says that on an average there are 29 trucks per day coming in. Well, the need is actually 500. So it's a total strangulation of Gaza. It's a total strangulation of the healthcare, and this has to stop. We cannot fix this with bandages and some medicines.
All right, Dr. Mads Gilbert joining us from Oslo. Thank you so much for coming on CRT World this evening.